Dr. Datta, I came to Datta Endoscopic to learn about alternative techniques to a major back surgery. I'm a little bit scared of open back surgery, as you can imagine. I love to hear, what you have and what you practice at Datta Endoscopic here in New York.
Sure. We have perfected minimally invasive techniques. By minimally invasive, I mean where we have very small incisions. You're allowed to go home the day of the surgery and you're back to work within probably like a week's time, which is amazing considering the technology where it was 10 years ago. In fact, we've been perfecting these techniques for the last 10 years, and we offer some of the most cutting-edge techniques in our practice. For example, we are the home of the E-disc scalp procedure that we are famous for. With that, we basically use a small microscopic camera, and we are able to take a disc herniation out without major incisions and without putting metal into your body or fusing your spine. We have a lot of other minimally invasive options, such as using robotic navigation, where we use a robot that fashions exactly where we need to be in the spine, and it can be precise to millimeters. That allows us to be very minimally invasive and allows us to just address the pathology exactly where the problem is.
What are the side effects of these procedures?
Well, the side effects of the procedures are as you can have for any open back surgery, unfortunately, but because there is almost no incision, the side effects are also decreased. For example, it has been well known and documented that these procedures lessen the amount of blood loss that you can have during the procedure. It also lessens hospitalization. And it also lessens the chance of getting infections because you're not in a hospital, which is where you pick up most of the infection. So in these days of COVID, a lot of people are very concerned about getting into a hospital because of the possibility of getting an infection in the hospital. So this allows us to do most of the procedures are outpatient. You go home the same day.
And you do them at Datta Endoscopic locations?
Yes.
Where are those locations?
We have 12 locations spread over 2 states, in New York and New Jersey. We are a very mature practice. We've been in business for longer than 10 years. We are very reputed on the international as well as the national level. Our doctors speak on a variety of topics and educate other physicians on these procedures. Our main location is in Manhattan and Fifth Avenue, overlooking the Empire State Building.
Okay, thank you, doctor. I appreciate it.
Thank you.